October is the month of the year dedicated to raising awareness about breast cancer. Breast cancer is a type of cancer that affects breast tissue, and even though it is seen predominantly in females, it can also affect males. Affecting 7.8 million women globally as of 2020 and 1.1 million women in South Africa, breast cancer is one of the most prevalent cancers globally and nationally. Many notable symptoms can be early signs of breast cancer. In a resource-limited country such as South Africa, these can be useful to note so that one can detect breast cancer early and take necessary measures to prevent the spread of the cancer while still possible. Disclaimer: it is important to remember that breast self-examinations are only to familiarize yourself with the normal look and feel of your breasts, helping you detect changes and abnormalities, but do not serve as replacements for professional examination. These include 1. Looking for any changes in the skin texture covering the breast. You can do this by looking at your breast in the mirror and looking for any indentations, puckering, dimpling of the skin that looks like an orange peel. 2. Assessing the feeling of the breast tissue for any lumps. You can do this by lying on your back and using the 3 middle fingers of your left hand to gently press down and using small motions to examine the entire right breast. Then sit up or stand and feel the armpit area using the same technique. Then lastly, squeeze the nipple, checking for any discharge. Repeat this on the left breast using your right hand fingers. 3. Checking to see any changes in the shape of the outline of the breast and if the nipple turns inward. The best time for females to do a breast self-examination is about 3 to 5 days after their period starts each month. For older individuals who have gone through menopause, the best time is at the beginning of every month. If you notice any notable changes to your breasts, especially if you have a family member affected, it is advised to immediately visit your nearest healthcare facility and to speak to a medical professional for a professional assessment. And lastly, remember that while most breast cancers are sporadic, some cases occur due to inheriting a gene mutation that increases a person's risk of developing cancer. In these cases, people may present with a family history of cancer, a young age of cancer diagnosis, and sometimes even more than one type of cancer in a family. Contact a genetic counselor if you are concerned about your personal or family history of cancer. Genetic counseling can assess the risk of carrying one of these mutations and provide information about genetic testing and risk management.